Hi, I'm Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. A septate uterus is a congenital uterine anomaly where a band of fibrous tissue or septum divides the uterine cavity partially or fully. This structural abnormality can interfere with conception, embryo implantation, and pregnancy progression. Let's try to see how septate uterus affects fertility. It can impair blood flow and affect the endometrial environment by bringing down the quality. The septum is typically made of fibrous avascular tissue, meaning that it lacks a proper blood supply. When an embryo tries to implant on or near the septum, it may not receive sufficient oxygen and nutrients due to the poor vascularity of the tissue. As a result of this, embryos that implant on the septum often fail to thrive, increasing the likelihood of implantation failure or early pregnancy loss. It can also alter uterine shape and reduce space for the embryo growth. A septate uterus alters the normal pear shape of the uterine cavity, effectively creating two smaller compartments. This reduced space can restrict embryo development, causing miscarriage due to limited room for the fetus to grow. The altered uterine shape can also lead to abnormal fetal positioning. It could be breech presentation, making it a challenge to carry the pregnancy to full term. A septate uterus also increases the risk of recurrent pregnancy loss. Women with this kind of a uterus experience higher rates of recurrent miscarriages compared to those with a normal uterine shape. Miscarriages often occur early as embryos fail to implant successfully or are unable to receive adequate support from the endometrium. Studies suggest that a significant proportion of women with unexplained recurrent pregnancy loss may have an undiagnosed septate uterus, with the septum acting as a persistent barrier to a successful pregnancy. The septate uterus also has an effect on embryo implantation and hormonal receptivity. The abnormal shape and reduced endometrial surface area in the septate uterus may impact the uterine lining receptivity to an embryo, which leads to lower chances of embryo implantation even if fertilization occurs. Now, additionally, hormonal signaling may be disrupted by the septum. This further brings down the lining's ability to support implantation and early embryo growth. Treatment includes surgical correction, where the septate uterus can be corrected with a surgical procedure called hysteroscopic metroplasty, which removes the septum and restores a single unified uterine cavity. This procedure is minimally invasive and has shown to improve fertility outcomes. So, a septate uterus can impair fertility through the effect on blood flow, uterine shape, and embryo implantation. However, with poor diagnosis and treatment, such as surgical correction, women with a septate uterus can experience much improved fertility outcomes and successful pregnancies. If you wish to know more about this or have a septate uterus, please feel free to contact us for further diagnosis and treatment. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.